Hello friends, I am Arpit and I am here with today's analysis. Today is 27th of March and we have celebrated this auspicious festival of Holi. So belated happy Holi to all of you who watch me regularly. I hope you've enjoyed yourself along with your family and friends. Now, after this, break of 3 days and, Holi celebrations were there, we have decided to continue with this series, today's analysis, in which I decode important topics which are in current. But from today onwards we have done an addition, and that addition will definitely going to help you. That addition is that we will be covering 5 MCQs related from the topics every day I teach. So first I'll be teaching the topics and then 5 MCQs related to that. I will be showing them on the board, but I will not be discussing them. You will have to find the answers to those MCQs. Largely they will be related to these topics, but yes, I will try to also include certain elements in the MCQs where you need to think and connect. Those explicitly may not be mentioned in the content, but with proper thinking, applying common sense, you can get to the answers. The idea is to make you practice MCQs and make you think in the right directions or in those directions which are connected with the topics which we are studying. So let's get started with today's analysis. The first topic is tuberculosis care, a person-centric approach needed. TB, which happens to be a bacterial disease, has plagued India from long. India has the highest cases of TB in the entire world, and thus Indian government had launched the Prime Minister's TB Mukt Bharat initiative in 2022 to eradicate TB completely by 2025. However, the SDG aims to eradicate TB in the entire world by 2030. Rigorous testing, medication, awareness definitely are main pillars of this eradicating TB. But yes, a person-centric approach is needed in which we are taking into concern the concerns of all the TB patients who have undergone treatment. There is stigma attached with it, there is social exclusion attached with it. So all those things need to be concerned for a holistic approach to eradicate TB in India. Next is new rules for elephant transfers. This has come into light especially after the formation of Vantara, which is basically an elephant zoo or animal zoo where animals are rescued and they are taken care of. So new rules have also come into place. These rules allow captive elephants to be transferred from one owner to the other owner if the owner is not able to take care of the elephant. The chief wildlife warden is basically responsible for the transfer of elephants from one state to the other state as well as within the state. However, if within the state the elephant has to be transferred, medical testing has to be done. If outside of the state the elephant has to be transferred, it has to be undergone genetic profiling. So these are some new rules which are there with respect to elephant transfers and has to be known by you aspirants. So let's get started with the first topic, that is tuberculosis care. Now tuberculosis is basically a disease which has impacted the entire world and especially the underdeveloped and developing countries. The incidences of TB or the cases of TB are more in such countries. Why? Because the living conditions, the standards of living in these countries are not so apt, which actually lead to spread of this kind of disease also. India has the highest number of TB cases in the world. Around 27% of the entire cases in the world are in India. This is a fact and figure of 2022. So we need to devise, robust strategies to tackle this, big disease which is there. At times, TB, is asymptomatic. So it becomes much critical or much, I would say, challenging in those circumstances in which it is much challenging and it is unsymptomatic or non-symptomatic. So we need to address this public health challenge in a robust way. This is impacting millions. Government of India launched this program to eradicate TB, Pradhan Mantri TB Mukt Bharat, in 2022. Now, when this program was launched, the aim was to eradicate TB by 2025. Global aim is to eradicate TB by 2030, but India has kept itself a target 5 years, before the global target, despite the fact having the highest number of TB cases. So will it be achieved? That is a big question. We need a multi-pronged strategy to tackle TB, and unfortunately, we are not able to, be on track, I would say, to reach or to achieve the target by 2025. So this particular topic is all about discussing the approach, what needs to be done, where we are lacking. But before going into this, what is tuberculosis? We should know this as well. It is caused by a bacterium called Mycobacterium tuberculosis. The bacteria usually attack the lungs, where you would have seen multiple or most of the TB patients coughing. But TB can attack any part of a body such as kidney, spine and brain as well. You can have stomachache in TB as a symptom. So that is not only limited to lungs. First of all, we need to know that as well, and UPSC asks questions on these lines as well. Because the major, I would say, or the perception among most of the public is that TB is, a disease which attacks the lungs where people are continuously coughing. So not everyone infected with TB bacteria becomes sick. This is also a big challenge. It is asymptomatic. And when it is asymptomatic, so it becomes more difficult to tackle such kind of, diseases. Now, what are the symptoms? Fever is a symptom. Fatigue is a symptom. Weight loss is a symptom. Persistent cough is a symptom. This is where, it has attacked your lungs. Blood in cough is a symptom. Night sweats is a symptom. So all these are symptoms of TB. How does it spread? It simply spreads through this, like this way. Like a person who is having this bacterium Mycobacterium tuberculosis in his or her body, coughs and sneezes, and those bacteria are, then airborne, get into the air, and when you breathe in that air, those bacteria get in you, and this is how you get infected. So it is always advisable to put your hand before your mouth if you are coughing or sneezing. These are general etiquettes, and most of the people, especially in rural areas, do not follow this basic etiquette, and this leads to, spreading of this particular disease more and more. So this is how it spreads. What needs to be done? Simple things can come to your mind: increased testing, developing an effective vaccine, or proper healthcare. All these awareness among the public. These are some general points which might come to your mind, and that is completely fine. These should be done. But apart from this, there is also one other major aspect which is, I would say, ignored till now. And there needs to be a paradigm shift. Those who have been affected and their lived experiences of TB, those experiences have to be taken into account. And, incorporate their experiences in the policies which we design for tackling TB. Why the shared experiences become important? Because, those people who are having TB, who are diagnosed with these kind of diseases, they face social stigma. They face mental harassment, or their mental health goes, down. They face social exclusion as well. So not only those people, but, their family members, the healthcare workers who are treating TB patients, they also face this. Because, as we know now, by now, that how it gets spread, it is airborne. A person having TB coughs or sneezes, and then the bacteria enters your body. So those people who are in contact with TB patients, they also face these kind of stigmas or these kind of exclusions. That also has to be addressed. Not only for the TB patients, but also for the near and dear ones, and especially for the healthcare workers who are treating TB patients. Now, at the core of this shift lies a fundamental recognition. First, this is the needs and interests of patients and communities must be prioritized within the care paradigm and healthcare system. This principle, echoed by survivors, communities, health experts, and policymakers, underscores the need for a person-centered approach to TB care and management. So it should be more people centric. How people are feeling who are experiencing this disease, or who are infected with this disease, or their near and dear ones, or the healthcare workers. We need to address their, I would say, psyche, or their mental concerns as well. And this will only happen if we take into account their lived experiences. So lived experiences of those people are very important in a policy formulation. Perhaps our greatest gap has been in understanding the lived experiences of affected individual fighting and surviving TB. Now, how we have neglected these experiences? Too easily we assume their needs, those people who are suffering from TB, and act accordingly, their challenges and their expectations. We have at times been guilty of over medicalizing them. Over medication has been given to them, which has deteriorated their condition. We have often forgotten to see TB as a human crisis, a gendered crisis, and economic challenge, and social and environmental one as well. We are not seeing this TB as these kind of challenges. Social and environmental one, like for example, if you are living in detrimental living conditions, no ventilation or sanitation and all is very poor, more chances of getting TB. So tackle that. The Pradhan Mantri Awas Yojana or Swachh Bharat Mission aims to do that. Economic challenge. When people who get this disease, they obviously will be bedridden, or since there will be social exclusion, so they will not be able to go to work. They will experience fatigue as one of the symptoms which we saw, and there will be loss of income. If they are above poverty line, there are more chances that they will be dragged below the poverty line. If they are already below poverty line, they will further drop down. Remember, in India, majority of the workforce is in the unorganized sector, where you don't have social security. Social security is like paid leaves, or insurance for getting treatment and all. So all these factors have to be considered as well. They have been ignored largely. Now, have something been done in this regard? Now, there have been many advocates who have been furthering the concerns of the TB survivors, their lived experiences. They have those people who have survived TB, they have come out of this particular disease, they have won that battle. But during their fighting with this disease, they faced a lot of other problems. And those are all part of lived experiences, like social stigma, social exclusion. They underwent poverty because cost of this treatment is actually free from the government, but they are not able to go to work. They are losing their jobs. This is one such, I would say, impact on their lives. So these advocates who have started advocating the concerns of the TB survivors, or they have kept forward their lived experiences. Now the government has also started taking into account these experiences of the people. But the word is, the government has started taking into account. We need a holistic policy framework where these concerns, the lived experiences of the people or the survivors of this particular disease, are an intrinsic part of the policy. So that needs to be done. So what needs to be done? First, we need to bridge the gap between policy intent and on the ground realities. Policy intent is to eradicate TB. But will we be able to eradicate TB if we do not take into consideration the lived experiences of the people? Obviously, no. So what we need to do, India needs to prioritize targeted interventions aimed at improving and expanding access to TB diagnosis and treatment. So we need to figure out where are the incidences of TB more. So there we need to increase and intensify testing. We need to expand the reach of TB testing facilities, particularly in rural and underserved areas, and ensure the availability of free, affordable and quality assured TB drugs. Molecular testing. This is the, I would say, most sensitive test to detect TB. Is the gold standard, and less than a quarter of symptomatic patients are getting that as their first test in India. So this molecular testing has to increase. If this increases, we will be able to identify these cases among the patients at a better rate, I would say, and hence the treatment will be there for those people. Now, finding these patients becomes very important, because if we find and start their treatment and educate them about the do's and don'ts, there can be higher chances that this TB will not get spread to other people by those patients who are tested and detected with TB. So, this is basically the main idea behind this increased testing. Care needs to be more humane. Mental health support and gender responsive care becomes critically important. Now, here also, if a female contracts TB, she's, I would say, um, socially excluded to her next level. The degree of social exclusion for females is more. This has been experienced in especially rural India. So that needs to be tackled. Efforts are also need to strengthen community-based TB care models, where we are taking into, picture the members of the community and they are helping in spreading awareness, or they are helping in reducing the social stigmas, I would say. Empowering frontline healthcare workers to deliver comprehensive care which addresses not just treatment but also social, economic, and mental health needs of the patients and there also. Then, addressing the socio-economic determinants. Like as I said, they become poor, they fall in under poverty line or below the poverty line. Those who are just above poverty line because there is loss of work, loss of, I would say, mandates. Now, this TB, if it is affecting the rich people, it can affect anyone. It can affect the rich also, the poor also, because the bacteria does not know that what person is rich and which person is poor. But the impact of that particular disease, that is TB, on the poor is more as compared to the impact on the rich. It disproportionately affects the most marginalized in society, including children, the urban poor, prisoners, and people living with HIV/AIDS. It is an economic crisis as well, which by some estimates costs India billions of dollars in losses each year and pushes families and communities into debt and poverty. Addressing the socio-economic determinants of TB requires a multi-sectoral approach. Poverty alleviation, improvement in nutritional status, well-ventilated housing, and better air quality will all contribute towards reducing TB. So, these all have to be kept into mind, and this is where UPSC again poses questions where it needs you to be, or where it needs you to think multidimensionally. Then, leveraging technology and innovation. Adoption of AI and digital health solutions for TB diagnosis is, I would say, a win-win situation. If we are able to detect TB in early stages by the usage of AI, then obviously we can start treatment at an early stage. It can reduce the losses, economic losses, or it can reduce social stigma, or it can reduce losses in life also. Then, by investing in developing better vaccines, we can hope to ultimately eliminate this airborne disease. So we can do more and more research and development also. So this can also help. Now, the path to TB elimination in India requires a concerted efforts to prioritize person-centered care. This has to be done. Address social determinants of health and embrace innovation. Now, by adopting a holistic and person-centered approach, India can overcome barriers that stand in the way of TB control and create a healthier future for all its citizens. So, one or single pronged strategy for elimination of TB is not the answer to this question that will we be able to eradicate TB. I'm not quoting as of now the year by when we will be able to eradicate, but yes, generally I'm asking this question that will we be able to eradicate TB by only a unilateral approach? If we only focus on medication and healthcare, will we be able to eradicate TB? No. We need to focus on that. We need to focus on person-centric approach to eradicate TB, where we are addressing social stigmas, socio-economic conditions of the people, as well as we need to take into account the technology, the usage of technology or application of technology in this overall ecosystem of detecting and treating TB. So with this multi-pronged strategy, we will definitely be there. It is difficult to predict as of now whether we will be there where we have eliminated TB by 2025 or later. But yes, we have to be there. That is clear and sorted. Now about this TB Mukt Bharat, September 2022 was the date when it was launched. Now it has been envisioned to bring together all community stakeholders to support those on TB treatment and accelerate country's progress towards TB elimination. According to United Nations Sustainable Development Goals, eradicating TB by the year 2030 is part of this SDG. However, Government of India has set a target to eradicate TB by the year 2025. TB causes the largest number of deaths among all other infectious diseases in India, and India has little than 20% of the global population, but 27% of total TB patients are found in India and the world. So if there are, let's suppose, 100 TB patients in the world, 27 of them will be in India, and this is the highest. So we need to act, and we need to act now. We need to act in a concerted way. We need to act in a coordinated way, and multi-pronged strategy needs to be adopted. Next is new rules for elephant transfers. Now, elephants are those animals which are there in the wild also, and which are there who have been captivated as well. They can be captivated for multiple reasons, like religious purposes, or for transporting, for forest management. The I would say rich people, or I would say the royal families, they possess elephants till date. So I was watching a video last week where, in South India somewhere, a religious procession was happening, and two elephants, they started fighting during that religious procession, and their fight was, very, very, I would say, dangerous. While looking at in the phone only, I could sense that how could the people be feeling in the vicinity. So for multiple purposes they are captivated, but now the rules have been issued for transferring elephants from one to the other. The transferring elephants means those who have been captivated. Now the rules 2024 rules have liberalized the conditions under which elephants may be transferred within or between the states. Okay. The rules are known as Captive Elephant Transfer or Transport Rules 2024. But to understand these rules further, we need to first understand the legalities with respect to elephants in India. Elephants are part of Schedule 1 of the Wildlife Protection Act, and therefore, be it wild or captive, cannot be captured or traded under any circumstances, because elephant or animals mentioned in Schedule 1 cannot be traded under any circumstances. But hold on, as of now, there are certain exceptions. Section 12 of the Act allows Schedule 1 animals to be translocated for special purposes. Education and scientific research. For this purpose, they can be translocated. Population management of wildlife without harming any wild animals. Collection of specimens for recognized zoos, museum, etc. Now the captive elephants. Captive elephants, they are captive for multiple reasons, like forest management, timber transport, presence in estates of erstwhile royal families, in temple precincts. For religious purposes they are made captive. They can be owned and therefore come under a special category. See, we read that Schedule 1 they are therein, so they cannot be traded or they cannot be controlled, but they come under a special category, and hence they can be made captive for the following purposes. Section 42 of the Wildlife Protection Act 1972 prohibits the acquisition, possession and transfer of a captive elephant without the written permission of the Chief Wildlife Warden of the state, which happens to be the highest forest officer in the state. So without his permission, possession and transfer, acquisition, possession and transfer of any elephant cannot happen. Until 2021, the captive elephants were not allowed to be commercially traded. But in 2021, there were rules issued by the government which allowed elephants to be traded. Okay. Allowed the transfer of elephants for religious or any other purpose. Now this is very, I would say, wide, any other purpose. And this was hence criticized by multiple, conservationists. The new rules which are there with respect to transfer of captive animals or captive elephants. These rules provide new relaxations under which captive elephants can change owners or to be transferred. For instance, if there is a situation where the present owner of an elephant is not able to afford the maintenance of that particular animal or that elephant, then that person can choose to transfer this elephant to any other person. Now, these include, for instance, situations when an owner is no longer in a position to maintain the elephant, or when a state's chief wildlife warden deems it fit and proper to transfer the elephant in circumstances which can call for better upkeep of the elephant. So that person can transfer the elephant, but that too with the permission of Chief Wildlife Warden. Then, before a transfer within the state, an elephant's health has to be ratified by a veterinarian, and the deputy conservator of forest has to establish that the animal's current habitat and prospective habitats are suitable for the elephant to be transferred. The chief wildlife warden, on the receipt of such documents, may choose to reject or approve the transfer. So the deputy conservator of forest will find or will approve that the health of that elephant is fine and the habitat to which this elephant is going is also suitable for that elephant. Now when that document from this deputy conservator goes to the chief wildlife warden, it depends on the chief wildlife warden to either accept it or reject it. This is happening with this is the procedure when transfer happens within the state. If the transfer involves moving the elephant outside of a state, from one state to the other state, interstate transfer is there, then before the transfer is effected, genetic profile of the elephant has to be registered with Ministry of Environment, Forest and Climate Change. Genetic profile means the genes and all of that elephant has to be noted down, and we come to know about this genetic profiling, from this genetic profiling, that of what genus this elephant is and whether the elephant which is being translocated to the other state, what kind of threats it can experience in that particular state. So that becomes important. Earlier rules required that an elephant being transferred from one state to the other, say from Assam to Gujarat, by road. So in this process, each and every state which will come in the way from Assam to Gujarat, like from Assam, first state West Bengal, then Bihar, then Madhya Pradesh, and then Gujarat. So the chief wildlife warden of every state has to approve the translocation of this particular animal from Assam to Gujarat. But now, what is the new rule is that chief wildlife warden of Assam, chief wildlife warden of Gujarat will approve it, and translocation of that elephant can happen. Not the states which will be there in the passage of that translocation. So this is basically the new rules. These new rules definitely have made it easy for the wildlife to be the elephants to be transferred from one place to the other, or one owner to the other owner. Now with this we've ended the topics of today. Now we are entering into the MCQs. So 5 MCQs are there. I'm not going to discuss these MCQs, but yes, I'm just going to show them to you. Consider the following statements with respect to TB and mark the correct one. Comparatively, it is easy. TB is a bacterial disease which can attack the lungs only. TB is airborne. I hope you guys will be easily able to answer this particular question. Second is, consider the following statements with respect to TB in India and mark the correct one. TB Mukt Bharat aims to eradicate TB in India by 2030. Easy it is. TB causes largest number of deaths in India among all infectious diseases. Again, an easy statement it is. India has the second highest patients of TB in the world after Brazil. Very easy, this question is. Which of the following factors can contribute towards reducing TB? This is very, kind of thinkable question where you need to think. Reducing poverty, better nutrition, better ventilated houses, better air quality. So, what all can be the factors which can contribute towards reducing TB? Now, which of the following statements are true about elephants in India? Elephants are part of Schedule 1 of Wildlife Protection Act. Cannot be translocated for population management. Again, it is easy. The approval of chief wildlife wardens of all the states from where the translocation of elephants is happening is compulsory. If an elephant is being translocated within the state, genetic profiling of that elephant has to be registered with the Ministry of Environment, Forest and Climate Change. Very easy it is. It is just a matter of recalling the facts which we have studied. And the last question is, which of the following are the reasons to captivate elephants? For religious purposes, they can be captivated. For forest management, they can be captivated. For transportation, they can be captivated. And for recreation activities, they can be captivated. You need to think, because this question is not direct from the topic which we have studied. some, I would say, molding of words I have done in this particular question, but yes, if you're able to answer it, it is well and good. Now, you will be getting the answers also in the document, which gets uploaded along with the video. If you see down the video and in the PDF format, but yes, I am not telling you the answers right now. You attempt these questions by yourselves and try to answer these questions. Any doubt, any questions, you can ask me in the comment section. Most welcome. With this, I end today's session. I will be meeting you tomorrow now with more such informative news pieces and MCQs. I can, say this as well. Till then, you guys very well know what to do. Not repeating it today. So, namaste. Jai Hind.